Hello, I'm Dr. Paul Billings. I'm an internist and medical geneticist and have for the last couple of years run a biotechnology company here in San Diego. In my past life, I've done research on the genetics of psychiatric illness, and I have been the medical director of the Mass Mental Medical Hospital in Boston, Massachusetts. We are experiencing worldwide a epidemic, maybe a pandemic, of mental health disorders, whether they be anxiety, post-traumatic stress syndrome, depression, psychotic disorders. All sorts of mental health challenges are becoming more common in our society. This is troubling, and our treatment armamentarium has been very limited. We have a history of talk therapies and a limited group of pharmaceutical interventions, which only work in a fraction of the patients who are affected with often very debilitating and severe mental health disorders. So anything that we can do to comfort patients who are experiencing mental challenges, comfort individuals who have known psychiatric disorders and are experiencing an exacerbation, or have never been diagnosed and simply have anxieties, insecurities, inability to perform to their expectation. All these indications would be wonderful additions to the armamentarium of psychiatric care. And so GOT-IT represents the use of an app and of cognitive interventional therapy, which allows one to essentially learn how to treat oneself by talking to yourself, which many of us do a lot anyway, in our heads or even out loud in the shower. But GOT-IT brings to bear research on this question of the use of cognitive behavioral therapy for the treatment of anxiety and other kinds of situational and interpersonal dysfunction, and allows one to treat oneself, and extends this treatment to more and more people. Now, we need more experience with these kinds of software applications, just as we need more experience with things like generative augmented information, AI. So these are all areas where we can participate in research, get real-world evidence of what works and doesn't work, and hopefully make more and more lives easier to live and pleasanter. So thank you very much for the opportunity to comment on this.